Jambo, everybody. Good morning or good afternoon, whatever time it is in your countries. My name is Peter Mutie. I'm the Executive Director of Peterson Integrated Communications Limited, which is a firm based in Kenya, Nairobi, but with operations in the continent. And we are members of Global Alliance. And in this month of April, Global Alliance is doing trainings as a theme for the month. And so we are participating in that initiative. And we decided to choose a very timely topic, which is leadership communication during a crisis. And we specifically want to focus on the case of coronavirus, the COVID-19 global crisis. And in our discussion today, we are going to look at the mental readiness for effective crisis communication. I'm being joined by my colleague, Martin Ocholi. And Martin is a senior consultant with Peterson Integrated Communications. And he's also a trainer, a lecturer and a mentor in a couple of institutions. So this crisis, COVID-19, is actually a worldwide crisis which is unprecedented. This virus is threatening to spread to every village, estate, town, city, globally. It is the first of its type that we are witnessing in our times, and the crisis is calling for communication professionals, my colleagues and myself, to get involved and to provide effective advisory so that the world, the organizations that we work for, the countries where we live, can effectively intervene. Very important to start by saying that the COVID-19 presents several crises that are wrapped in one. It is actually a public health crisis. That is one phase of it. However, it is also an information crisis because a lot of people in the globe and in the various countries where we come from need information, correct information, timely information on this virus. It is an economic and business crisis. Economic at the macro level, because countries are being forced to reorganize, rethink budgets so that they can provide resources, something that was unforeseen. Business crisis because businesses are closing. Tourism, as we know it, is completely impacted. Aviation industry is seriously impacted. The informal sector is seriously impacted. Every business globally. It's also a social crisis. We are being moved to different ways of relating, something that we've never envisaged. We cannot shake hands. We are used to shaking hands. We are used to hugging each other. We cannot do that. We cannot congregate in our places of worship, churches, mosques. Even worse, we cannot visit our sick relatives in hospital. We can't bury the dead because the virus will very easily spread in cases of contact. And therefore, and we can isolate several other crises within this one crisis. As communications people, we are used to handling a crisis at a time. A plane has crashed, we look at that, we manage it. But this is a crisis that has got several of them in it, presenting a challenge for us. And of course, we have to rise to the occasion and provide advisory on how to move around the crisis. I have seen a pattern globally of how the crisis is developing, the snowball effect of it. A case is reported, and this actually replicates in all the countries where we have had this, and it's almost everywhere now globally. The case is reported and announced by the leadership of of a country. Day 2, day 3, more cases. And then we start seeing some prevention measures being brought on board. Next week, the crisis keeps growing, things are getting worse, and more measures are brought on board. Schools are closed, we are told to work at home. And as we move on to week 3, week 4, we find ourselves in full-blown crisis. There is an explosion, and the country is in shutdown. That phase of coronavirus is replicated all over the globe. And therefore, as communications people, one of the questions we have failed probably to advise properly, and even as government, is what interventions do we take at what stage? Do we shut down when we are facing the fully blown crisis, or when the first case is reported and then we turn off the tap of infection? Serious issues that we needed to have advice, and I think it is not late. There are countries that now are reporting the first 10, 20, 30 cases. And this is a learning session. I believe those countries will make the right intervention so that you don't wait until the crisis is fully blown and then now you are running up and down. There are discrepancies in messages and action that we have observed as Peterson because we have followed the patterns globally. And crisis response, as we know it, is what we do plus what we say. Now, if there is a discrepancy between these two, that leadership communication is not effective. Let me just give a few cases. We have seen leaders hosting press conferences to talk about social distancing, yet crowding on a microphone. So you're there, the Minister of Health, the President, but you are in a crowd of people who have come with you and you're talking about social distancing. What we do must be in congruence with what we say. It must rhyme. If that doesn't happen, then that communication is not effective. Messages on washing our hands as a way of preventing transmission. Very good message everywhere. Yet, big portions of populations, especially in developing countries, don't even have water. So if as a Minister for Health, you're talking about washing hands to a population in a rural area that has got no water to drink, first of all, your message cannot sink. Sanitizer usage is being encouraged, good, as an alternative to washing water, but some of these rural folk don't even know what it is. So as leaders, we need to ensure that what we are communicating rhymes with the people, and what we do is exactly what we say. Rather, what we say is what we do. If there is discrepancy, then there is going to be a problem. Let me come to the mechanics of successful crisis communication, and I will relate this to the coronavirus. The key to successful crisis communication is mental readiness on the side of the leaders. And mental readiness comprises three interrelated things. The first is emotional discipline, the second is deep knowledge, and the third is intellectual rigor. And I would like to appreciate and acknowledge Professor Elio Fred Garcia, my good friend, from whom some of these thoughts have been taken. And so how do these three manifest in crisis communication and leadership communication at this time when we are facing the coronavirus crisis? Let me start with emotional discipline. The ability for the leader to shut off panic when things are going wrong. Emotional discipline is that capacity to stay calm when everybody else is panicking. And I'd like to ask my colleagues globally, have you seen undesirable decisions that are being taken out of panic? I can enumerate many decisions that I've seen our leaders taking out of panic and therefore making undesirable course of action. As leaders, they should be able to remain calm. That is the emotional discipline part of it, so that we negotiate through that crisis effectively. The second item is deep knowledge. Deep knowledge refers to understanding the patterns of COVID-19 crisis, and therefore having a clear idea of what works best, what works sometimes, and what doesn't work at all. Harvesting lessons from where some of these interventions have been done and done successfully. I think now we have seen one in China coming back to life. And therefore, as countries, are we learning from some of these interventions so that we are able to intervene successfully? Do we keep taking interventions that have seen not to work? Which is the best timing for lockdown, for example? I want to articulate one intervention that I've seen, and that is the intervention of keeping social distance. A lot of countries have gone through that intervention, but it doesn't work. Social distancing will not work without some form of enforcement. For example, we are not going to tell people to keep social distance in a public beach, in an amusement park, in a church. So if, as leaders, we want to communicate effectively social distance, then there will need to be some form of enforcement. Deep knowledge will also involve studying the actual crisis in some of these countries that have gone through them. Singapore is still going through the crisis, but managing very well. Harvesting lessons from those countries that seem to be succeeding, and then so implementing interventions without going through the trauma they went through. The third aspect is intellectual rigor, and rigor generally, let me talk about rigor generally. There is rigor in crisis management, just like in other disciplines, just like in medicine, like in accounting, like in human resources. There is rigor in crisis management, and part of that rigor says we must defer certain action before we take other certain actions. But specific for COVID-19 intervention, that rigor says that we need to understand what our people or what our citizens expect from the leaders. And the citizens are expecting leaders to demonstrate care. To demonstrate care. People want leaders to demonstrate that they care by several actions. One, providing adequate public health services. If you are talking about COVID without addressing that particular issue, you are not demonstrating care. That leadership communication is not going to be effective. Providing support in the form of running water and sanitizers, especially in areas where these are not accessible. We are not only addressing people in the cities, we are addressing people in remote parts of our countries, and we must provide accurate and timely information in languages that are understandable and through accessible channels. And of course, communicating with empathy. And Martin Ocholi, my colleague, will talk about that. People want leaders to demonstrate care by addressing all the COVID-19 crisis dimensions that I talked about earlier. People want to know what will happen to the informal sector. I mean, where are they going to get basics such as food. We want to lock down a country. Good. Lockdown is going to cut infections. What about food? And people gonna come out and say, I would rather die from coronavirus than hunger. What happens after the crisis? The future. What does the future look like? I've not seen many leaders addressing that, and that is a deficiency in the messaging that is coming out. So, as I bring Martin on board, the guiding question while dealing with the COVID-19 crisis is this: what do responsible citizens appropriately expect their responsible leaders of government to do? And the answer to that question is that they expect people to demonstrate care. They expect their leaders to demonstrate care through the various actions that I've enumerated. Communication discipline and communication professionals have a major role to play in addressing these crises. We need to stand out and be counted in our organizations, in our countries, in the continents where we live, and in the globe, to providing advisory on the way to communicate effectively to resolve the COVID-19 crisis. I would like to invite Martin now to bring his thought on that topic as a way of summarizing before we close. Martin, come on board, please.
Thank you very much, Peter, and good morning, good afternoon, whatever time of the day is, wherever you are. Now, as Peter has aptly put it, I'll be very, very brief with this. Two main point that we have here is that we're in a crisis, and as leaders, this is a time everybody the world over is looking upon the leaders to give direction. There's total confusion, and the citizens all over are asking, where do we go? What next? How is the future? What does the future behold? At this time, we require leaders to be crystal clear in their communication. Where are we going? They have to have a very clear picture of where we need to go, a sense of direction. And then the second, provide an operating framework of values. How are we going to go there? What does each one of us need to do? In communicating effectively, I think we talk about language here in the first instance as a medium. Do we speak a language that is accessible to everybody that is listening, that needs to hear the message? I've noticed that most of the press conferences, like in Nairobi here, are in English. Yes, we speak some English, but there are certain critical things that need to be communicated in a language that the majority of the people or the majority of the audience are fluent or have total control of. And I think there we are sort of failing, and it's something that we need to have to take into account as our leaders in communicating that. The other aspect that I would like to talk about is also the choice of words, language from the words. It's really a time of total apprehension. A leader, like I look in my family, my children are looking at me and saying, Dad, is it going to be okay? Now, how they feel will depend on the kind of words I choose. If I choose the wrong word, then definitely I will going to hate the level of tension. If I'm seeking to influence, because in this case you find COVID-19 has brought a situation where, yes, we have the government or the leadership, they have the programs, but those programs cannot succeed if the majority of the population do not follow the laid down procedures or response mechanisms that are there. But the problem is, yes, are we trying to address the different audiences from their own uh, behaviors in a way that we can persuade them? And I know government has so many mechanisms. They can enforce, they can use the military, they can use the law enforcement agencies. But I think we always believe that symbol change happens when attitudes and behaviors change. And I think this is where we come in. Can we find a way that we can communicate with the citizens in a way that affects their minds, affects their behaviors, and therefore reduces the need for government to employ the other instruments at its disposal? And in this case, we'll be talking about the law enforcement agencies. Leaders, in this case, need to communicate or provide a framework where the different players can communicate with each other in a way that helps them to effectively understand their roles and execute those roles. Then I look at the aspect of persuasion. Since we cannot monitor fully everybody's behavior, then a leader needs to sort of come in and inspire the population, the citizens, with their communication. And that way they'll be persuaded. So they need to see the logic behind your actions. They need to see your own integrity. Who are you? Why are you telling us this? So it's just an example that has been presented earlier by Peter. You say practice physical distancing, and then you find 5 people surrounding a microphone in less than 1 meter. Is that correct? You can see, I've seen after a press conference, some of the leaders washing their hands and others not washing their hands. So what people see at the same time is really how they get persuaded, or they just think this is politics as usual. Um, and then lastly, do the citizens want to feel like you understand, you empathize with their situation. And in some countries where if you're talking about uh, staying indoors, and I look at informal settlements where a family of about 5 or 8 people live in the same room, how can they, by staying indoors throughout the whole day, day and night, are they increasing their chances? They're using the same watering points. You're telling them to stay indoors. They work, uh, they're casual laborers, so their survival depends on their going out to eke a living every day. Does the leader, as they communicate, take this into account and really put those measures in place? So communication will be in words and communication will be in action. And this is really a time that I think uh, for the first time, authorities have been placed in situations where they need to work at the people's minds through their ears, through their hearts. And your credibility as a leader will save the country from this calamity that has fallen. So I think basically this is what I would like to sum up from what Peter had said. Peter, I'll just hand that back to you.
Thank you very much, Martin. I want to finalize by saying that leaders in our countries, in the continent, and in the globe will navigate through this crisis successfully if they manifest mental readiness. And that comprises the emotional discipline, the deep knowledge, and the intellectual rigor of crisis communication that we talked about. It's a privilege, and we are honored to have been the ones facilitating this through the Global Alliance. And we look forward to interaction with this discussion throughout the month of April. We have provided our email address and our Twitter handle. So I would like to encourage our colleagues globally to share these particular thoughts and others, and let's support the globe through our very well-placed communications professions, to navigate through these crises. Crisis communication is a function of public relations. It's a time to stand up, be counted, support our countries, our organizations, the continent, the globe, to navigate through coronavirus crisis. Thank you very much.